At the King's Head in Columpton, landlord Derrick is making plans to reopen.
You have a mark on the bar so that two people can serve.
But it's not just his business that suffered. 6 weeks ago, this was Derrick in the Royal Devon and Exeter Hospital, gravely ill with COVID-19.
The first 2 to 3 days, I was ill. And I don't say that lightly, I was ill.
So sick, in fact, he was immediately asked to take part in the NHS-wide recovery trial.
Lovely, so there's 3 tablets there, all right?
The medicine he was put on, dexamethasone, is an anti-inflammatory normally used to treat common diseases like arthritis. Luckily for him, it happened to be the drug that doctors now know works.
Do you think this saved your life, this medicine?
Believe me, I know I was ill. So it may well have saved my life, but at least it seemed to work for me.
The recovery trial was designed to test drugs against the virus that hospitals already have in their pharmacies. It was seen as the fastest way to get some sort of benefit to patients. The idea was that dexamethasone might calm down the severe inflammatory illness seen in the sickest patients with COVID-19, and for some, it works. The drug only benefits higher risk patients needing respiratory support in hospital. For those needing oxygen alone, the risk of death is cut from 25% to 20%. That means 1 in 25 deaths is prevented. For patients on ventilators, the risk is cut more from 41% to 28%. That's 1 in 8 deaths prevented. The positive results embraced by the government's chief scientist.
This is the first medicine that's been shown to reduce death in any group with COVID, and that's the start of something. So it shows this is possible to do, and as other drugs get looked at, the hope is that they'll add on top of that.
Dexamethasone has been in daily use in hospitals for more than 60 years, but without the recovery trial and the patients who volunteered to take part in it, no one could have known that this cheap and readily available medicine could stop people dying from COVID-19. It's no miracle cure, but far more than they'd hoped for, given how cruel this disease can be.
Our jaws dropped when we saw the result. It's really a big result. For a severe disease in a largely elderly population, to have that kind of impact on a cheap and widely available drug is really surprising. So if we'd known this 4 or 5 months ago, we would have saved tens of thousands of lives, probably.
In response to the findings, this afternoon the Department of Health approved dexamethasone as standard treatment for all suitable COVID patients. With no other life-saving drugs available, it's likely other countries will follow the NHS-led breakthrough.